Asthma is a common condition that affects the airways in our lungs. When someone has asthma, their airways become swollen and narrow. This makes it hard to breathe. Asthma can affect anyone, from young children to older adults. It is important to know that asthma is a long-term condition. This means it doesn't just go away, but it can be managed with the right care. There are many reasons why asthma happens. Sometimes it runs in families. This means if your parents have asthma, you might have it too. Other times, things in the environment can cause asthma. Air pollution, smoking, and even weather changes can all play a part. Understanding why asthma happens helps in managing it better. People with asthma need to be careful about what they are around. Asthma can make life challenging, but it doesn't have to stop you from doing what you love. With the right information and help, you can breathe easy. Knowing about asthma is the first step to gaining control over it. Asthma triggers are things that make asthma worse. Common triggers can be found everywhere. Dust mites are tiny bugs that live in our homes. They are often found in bedding and carpets. Keeping your home clean can help reduce dust mites. Pets are another trigger. Some people are allergic to pet hair or dander. If you have asthma, you might need to keep pets out of your bedroom. Weather can also trigger asthma. Cold air and changes in temperature can cause problems. During the winter, many people with asthma find it harder to breathe. Exercise can be both good and bad for asthma. It is important to stay active, but overdoing it can trigger an attack. Always warm up before exercising and listen to your body. Strong smells and smoke are big triggers too. Perfume, cleaning products, and cigarette smoke are just a few examples. Avoid places where you might encounter these. Stress and emotions can also trigger asthma. Feeling very excited or sad can make it hard to breathe. Learning how to manage stress can help keep asthma under control. Asthma symptoms can vary from person to person. However, there are several common signs to watch for. Wheezing is a high-pitched whistling sound when breathing. It is a clear sign that the airways are tight. Shortness of breath is another symptom. This can happen suddenly or over time. It might feel like you can't get enough air. Coughing is also common, especially at night or early in the morning. Don't ignore a cough that doesn't go away. Chest tightness is a feeling of pressure or squeezing in the chest. It can be uncomfortable and scary. These symptoms can be mild or severe. Some people only have symptoms during an asthma attack. If you notice these symptoms, talk to a doctor. They can help you find out if you have asthma. Sometimes symptoms can be confused with other conditions. It's important to get the right diagnosis. Knowing your symptoms helps in managing asthma effectively. Asthma comes in different types. Allergic asthma is triggered by allergens like pollen and dust. Non-allergic asthma is triggered by stress, exercise, or cold air. Occupational asthma happens because of things at work like chemicals. Exercise-induced asthma happens during or after physical activity. Each type needs different management. Diagnosing asthma usually starts with a visit to the doctor. They will ask about your symptoms and medical history. A common test is the spirometry test. This measures how much air you can breathe out and how fast. Another test is the peak flow test. It measures how well your lungs are working. Sometimes doctors also do allergy tests. These tests help doctors understand your condition. Getting the right diagnosis is crucial for effective treatment. It ensures you get the right medication and advice. Remember, if you think you have asthma, see a doctor. Early diagnosis can make a big difference in managing asthma. Managing asthma involves medication and lifestyle changes. Inhalers are the most common treatment. They deliver medicine directly to the lungs, providing quick relief. There are two types of inhalers: reliever inhalers and preventer inhalers. Reliever inhalers are used during an asthma attack. Preventer inhalers help keep asthma under control long-term. Medicines like tablets and injections can also help. These are usually for people with severe asthma. Lifestyle changes are important too. Eating healthy, staying active, and avoiding triggers can improve your asthma. Always follow your asthma action plan. This plan is made with your doctor and tells you what to do during an attack. Prevention tips can help avoid asthma attacks. Keep your home clean to reduce allergens. Use air filters and avoid smoking. Stay away from known triggers whenever possible. Regular checkups with your doctor are important. They can adjust your treatment as needed. Living with asthma doesn't mean you have to stop doing what you love. Many people with asthma lead active and happy lives. With the right care, you can control your asthma. Focus on the things you can do, not the limitations. Remember, you are not alone. Many people have asthma and live fulfilling lives.